Hi friends, in this video I'd like to describe the ideal way to align a Toric plate haptic design intraocular lens. This is the marks which have been made, the site of incision and the axis of placement. A plate haptic design intraocular lens has a tip-to-tip diameter of about 11 millimeters, and once it's implanted within the capsular bag, it's quite difficult to rotate it because the bag diameter being 10.5 is evenly stretched with the plate haptic design. Also, the plate haptic lens is extremely thin, and trying to dial the haptic portion of a plate haptic lens may just cause the haptic to fold without moving. So I realized that the best position to take advantage of rotational maneuvers of a plate haptic lens is when the lens is in the anterior chamber. So let me show you how I handle the alignment in a patient who received a Toric multifocal 80 laser lens, and before that make sure that a good cortical aspiration is done and all the cellular debris are scrubbed out and aspirated, because these lenses have a slightly higher rate of PCO formation if residual lens epithelial cells are left behind. A well-centered rexis about 5.5 millimeters also helps in getting a good post-operative result. This is the Blumix injector that is provided for injecting the plate haptic 80 laser multifocal lens. I have no financial interest in the product, and after loading it, see how I align this lens. As the lens is injected into the anterior chamber, you have to make sure that the dialing hole is placed to the left. There's also a dialing hole in the center of the leading haptic and the trailing haptic. So once the leading haptic goes into the bag, do not implant the trailing haptic into the bag. Once it is outside the bag, it is very easy to rotate the lens. It can be rotated without any problem and without much of resistance. And once you've brought the lens to the correct axis of alignment, then just gently press the haptic in a posteriorward direction and the lens will just slip into place. The viscoelastic is then removed and finer adjustments are made. You have to align the first and the fourth Purkinje image that will give you coaxiality of the eye, and the other smudged out image which is seen in the white arrow is actually the Purkinje 3 image, which is not used for alignment. The rotation of the lens while it's in the anterior chamber makes the whole procedure simple and easy to handle. Thank you for your attention.